go.
Hi guys, good morning. It's Dr. Denny over at Fort Paz at Fulshire Veterinary Clinic, and today Maddie and I are going to be chatting a little bit about heart disease or cardiac disease. So there's a lot of questions that could come into this. As always, like these kind of conversations are actually much better had in the office, but I'm hoping this will at least give you a broad overview. Especially if you've just been here and your dog or your cat has been diagnosed with a heart condition.
Dr. Denny, how can cardiovascular conditions impact the health and well-being of my dog?
So I think let's flip this, okay? So what does your heart do for you? Okay? Like the heart is the organ that pumps the blood and oxygen and nutrients around the body, right? Like that's its huge job. Without a heart, there is no life. So what does your heart do? Keeps you alive.
What is a veterinary cardiologist?
So it's the same thing as a human cardiologist. Isn't that cool? How cool is that? We have specialty in veterinary medicine. I would say that every general practitioner veterinarian dabbles in every specialty. Like we are expected to know a little bit about everything. So do I know a little bit about cardiology? Absolutely. Okay. Are there times when I have trouble managing cases and I need a little bit of help from a cardiologist? Absolutely. And in that event, we're going to refer you to a veterinary cardiologist. They go through the same amount of training as our human counterparts. So they are specialists. I always say that I don't get starstruck with celebrities. I get starstruck with veterinary specialists because they're just amazing. They're like the top of our profession, and they're there to help.
What are some signs and symptoms of a heart condition in my dog?
So hopefully we will catch it before there are signs or symptoms. That is why it is so vastly important for your animal to be examined once a year. I mean it. I don't give a crap about vaccines. They are important. They are preventative medicine, but that physical exam once a year, and even when your dog is old, over the age of like 10, I think they should be coming in twice a year because that is how much things can change. It is our job as your veterinary care team to catch diseases before they have symptoms. So I'm going to hop off my soapbox now. Now we're going to talk about what you can see. Like a wet cough, exercise intolerance. So when I say that, I mean if you and Fluffy go for a walk every single night and it's like a 2 mile walk, or even if it's just around the block a couple times, and all of a sudden you're noticing that your dog is only making it, they just stop and they're just looking at you like, I can't do anymore. They're telling you that something is wrong. They should be able to make their same activity level. So if they're not able to handle regular activities, something is wrong. Okay. Coughing, like I said, is a big one. In really severe cases, they can faint. Like they can legitimately pass out because of lack of blood flow to their heart or to their brain. They can have strokes just like humans. They can have heart attacks just like humans. So if your dog suddenly collapses, I don't care that they get back up. I think that's great. Okay, yay, they got back up. But your next step, like your very next step, needs to be to call your veterinary clinic's office and tell them what happened. It's not going to be one of these like let's wait and watch and see kind of things. If this happens, your next step is to call a veterinary clinic's office. I don't care if it's 2 in the morning when this happens. You get your dog to an emergency clinic. I know it sucks, but when we talk about these things, because no one wants to go spend the money at the emergency clinic. I get that. No one wants to call and be told they're going to have to pay a work and exam fee because their veterinary clinic is completely booked. But this is the time you don't want to be cheap. Okay, your dog's life is hanging in the mix here, and early intervention and starting medications and diagnostics can 100% make the difference between keeping your dog alive and longevity versus losing them to this disease.
How soon should I bring my dog in to see a veterinarian if I suspect heart issues?
Immediately, like if you're listening to this and oh, I did forget one symptom. Your dog's tongue should always be like nice and pink. See, look at my tongue, pink. If my tongue is like purple or blue, that's not normal. If you're noticing that when your dog is walking or at rest or coughing or whatever, if their tongue is turning purple, that can be a sign of heart disease. But like I said, your very next step, should you see any of these symptoms, is to get your dog seen, because it is so much better to intervene early, because by the time you see these symptoms, it's not early anymore. We've missed early and now we're in damage control. And damage control, the faster we get damage control started, the better the prognosis is, because there are so many times that I will get new patients that come in because they're coughing, or the owner's like, she's really breathing hard. And I get to have the wonderful conversation, just meeting someone, about how their dog is in congestive heart failure, how the prognosis is not good, how it's going to take lots of dollars to try to save their dog. And at the end of the day, even after spending all these dollars, I can't guarantee that their pet's going to go home to them. So these exams once a year and twice a year when your dog is older, especially if you've been told that your dog has a heart murmur, we should be coming in every 6 months. But we've got to be on the ball on this, guys, because those conversations are horrible. I hate having those conversations because it's heartbreaking. I hate having to meet someone for the first time and I have to be with them while they feel like they've just been hit by a bus because I'm telling them that their pet is dying. Like, this is horrible. So these symptoms, your next responsibility, if you are listening to this video, is don't even finish this video. Hang up the phone, call our clinic, call your clinic. I don't care. Just call someone and get your dog seen.
How will a veterinarian diagnose heart disease in my dog?
So first and foremost, if this is on a routine exam, usually we will hear what's called a heart murmur. So that is where one of the valves in the heart is leaking. There's 4 chambers in the heart, and in between those chambers, there is a valve, okay? It's a valve. It closes, nope, it closes, it opens. And what we're hearing, lubbed up, lubbed up, lubbed up. That's what we hear when we're listening. When the valve isn't closing, or when a valve is diseased and it's not closing all the way, and when the heart's contracting, but this isn't closed, blood goes backwards and it wishes, and that's called a murmur. So that is heart disease. So if you've been told that your dog has a murmur, your dog has heart disease. And we grade murmurs on a scale of 1 to 6, 1 being the least scary, 6 being the most scary. So if you come in and I tell you, hey, like I'm hearing like a grade 1, I'm not going to be too totally concerned. I'm going to note it in the chart, and I'm going to make sure that you know that this can be progressive. I'm going to recommend chest x-rays and a cardiac echo. But I'm going to be getting your pet in every 6 months, and we're going to listen and we're going to track that murmur. So it's by listening with a stethoscope. In really severe cases, I can actually put my hand on the chest wall. If the murmur is bad enough, you can feel it reverberating through the wall. So physical exam is huge here.
What kinds of treatments are available for dogs with heart problems?
So it depends on when we catch it. Okay, if it's in early stages, then there are medications to help the heart pump more effectively. If we're catching this and it's a late stage and we're an active congestive heart failure where the fluid's either backing up into the lungs or into the belly, so left-sided congestive heart failure backs up fluid into the lungs, right-sided congestive heart failure backs up into the belly. So we can see these dogs with like big old abdomens, and the owners will be like, oh my God, my dog looks pregnant. And then I'm going to listen, hear a murmur, and I'm going to know, okay, well, we're in right-sided congestive heart failure. But there are medications to help drain the fluid and help the heart pump more effectively. There's pure oxygen. So people, you see them with the nasal cannulas and the oxygen on oxygen. Well, we unfortunately don't do a lot of that with our dogs unless they're big dogs. But we do have oxygen cages that we will put them in, because what we're breathing right now is 21% room air. We're able to give them 50, 60, 80% of oxygen. So if their lungs are super compromised, we're able to deliver more oxygen, even just smaller percentage, but that helps the pet.
Why is early detection and diagnosis of heart disease in dogs so important?
Because we have a chance to do something. And I just spent a little bit of time talking about what it's like when I catch these cases and they're in full-on congestive heart failure. And these are people I'm meeting for the first time. Early detection, these physical exams once a year, they're important. I don't care if your dog is indoor only. I don't care that, you don't believe in heartworm prevention or whatever. It's so still important that we are getting hands on these animals, once a year or twice a year, because heart disease happens. And if you catch it in the early stages, we can prolong the pet's life, like the quality of life. The goal is always quality. It's not quantity. Our pets aren't made to live, 20, 30, 40 years. They're made to live, 10 to 15 years on some on average. Um, so catching these diseases early is so important.
What types of preventative care can help my dog avoid heart issues?
So, some of this is genetic, some of it's bad luck. So, if you know you have a breed that is prone to heart disease, like boxers, Cavalier King Charles Spaniel, which, by the way, is one of my favorite breeds. I actually have a Cavalier King Charles Spaniel, but they are the poster children for heart disease. So, my dog gets a cardiac echo once a year and her heart sounds fine, and I don't care. She gets a full on echo every year because it's the breed. Smaller dogs will tend to be more prone to something called mitral valve disease. Larger breed dogs will be more prone to something called dilated cardiomyopathy or DCM, which has been linked to grain-free diets as of late. So, there are things to note, but some of it's genetics and some of it's bad luck. So I know this was a lot of information to intake. If you have just watched this video because either I or someone in my practice has told you that your dog has a heart murmur and you wanted to know more about it, or if you're coming from a different veterinary clinic and you landed on this video and you still have questions, like this is the time to sit down for a consult. This is the time to call and get an appointment and make sure that you've been walked through this disease. Make sure that you are understanding what's going on with your pet. I was at brunch yesterday with friends, and a friend of a friend is telling me that, well, they said my dog had heart disease. I was like, well, did they say you had a murmur? And she couldn't tell me. And what that tells me is whoever her veterinarian was didn't do a good enough job explaining. So if you are not understanding if what we're saying is going over your head, or if you are in emotional distress when you're finding out this news that you can't hear what we're saying, because that happens, and that's a human, that's being human. If you've received bad news, it is so hard to process everything else that's going into your ear. And that's why oftentimes I'll send out a handout, or I'll email a summary of what we talked about, or I'll talk to a husband or a wife who's not there. So there are multiple times that my clients are hearing these things. But if you don't understand what is going on, if you're only kind of like, okay, well, I know there's heart disease, and that's all you glean from it, I would say, like, please call and come back in for a consult, and let's spend some time going in through the ins and the outs, because knowing what's going on could mean the difference of catching this disease early and preventing the loss of your pet. So if you do have, questions, concerns, if your dog has been diagnosed with a murmur recently and you weren't clear on, what this means, what the medications are doing, why the meds are important, what to look for, please give our clinic a call and we will get you set up for an appointment and we will sit down and go through this with you, because it's a lot. It's totally a lot. So thanks guys for listening. Thanks for my TED talk here on heart disease. I hope you have a good rest of your day.